The average 10-year-old in America has taken 11 courses of antibiotics, and the average 3-year-old has taken 2.5 courses of antibiotics. We think that 0 to 3 age group is the microbiome is the most sensitive to antibiotics, but antibiotics are like carpet bombing your microbiome, these millions of bacteria that live in harmony. And this study, I don't know if I can mention this, but this Mayo Clinic study, this is what I was telling you before. I was dying to tell you about this study. Incredible study out of the Mayo Clinic that came out. I think maybe the most significant study of the modern era, in that it's shattering our deeply held assumptions about chronic diseases. In the Mayo Clinic, researchers took the 14,000 children that live in Olmsted County, in the area of Rochester, Minnesota, and they looked at kids who took an antibiotic course in the first 2 years of life and tracked whether or not they developed asthma, learning disabilities, overweight, obesity, later in childhood. And what they found were these incredible correlations. There were about 10,000 kids who had taken an antibiotic course and 4,000 who had not, and they matched them to the best of their ability statistically. A 20% increase in obesity among kids who had taken an antibiotic in the first 2 years of life. 21% increase in learning disabilities. These were all the statistically significant findings. 32% increase in attention deficit disorder. A 90% increase in asthma, and a 289% increase in celiac. Other studies have shown a correlation between antibiotics early in childhood and ulcerative colitis and Crohn's disease. Makes sense. We're changing the microbiome. We may be carpet bombing the microbiome with the dogma that there are no downsides to antibiotics. You got some sniffles, it probably won't help you, but it won't hurt you. Not true.